We're joined right now by Wanjiru Gikonyo, who is the Executive Director of TISA. And as we look at social protection this morning, Wanjiru, good morning.
Morning, Drew. How are you?
Very well, thank you. Keeping safe?
Hi to CT and Eric as well.
Hello, Wanjiru.
We are well, and how are you?
Very well, and yes, Drew, we are keeping safe.
Fantastic.
Doing the social distancing and all that it pertains.
Hence, we are talking to you from far away this morning as opposed to in the space.
Sorry, I missed that.
I'm saying hence social distance practice, hence you're far away from the studio this morning.
Yes, we've been working from the house for the last 2 weeks. We are one of the institutions that's able to do that. But what this means really is that apart from the regular check-ins, you can sleep until midday, wake up and work for 4 hours, or watch movies and then do your work at night. As long as when you're checking in, you hit your deliverables.
Right.
So yeah, it's a different experience. It's a different experience. But we're the fortunate ones. There are people out there who can't afford to stop because they live hand to mouth.
Right.
And they need to work to earn the daily bread. And that's the reality. So yeah, and what can we do to assist? Government is doing its part, flailing in some aspects, doing reasonably well in others, but a pandemic of this size really calls upon all of us to take initiative, to show solidarity. So it's a challenging time.
With what you feel is the heartbeat right now and what's going on in the country, what needs to be done, Wanjiru?
Wow, we're in uncharted territory. And I don't think there's necessarily expertise or the perfect way to do this.
Yeah.
But what needs to happen? Part of that is happening. We're getting regular, informed updates from the CS of Health.
Yes.
Kind of sober updates.
Yeah.
They need a lot more information. And so part of what is happening now is you're finding stakeholders, civil society and other actors demanding, okay, good, you've set up the basic, but we need to know which populations are vulnerable in terms of health, in terms of economic issues.
Yeah.
When you're talking about distributing food, we want to know, okay, so how is this being targeted to the vulnerable? We don't want cartels to regroup around COVID. So part of what needs to be done is already happening, which is the regular, informed, sober communication, but more information needs to come out.
Right.
The other thing that needs to happen, of course, is, the economy. It's amazing that we stop, and it's mind-boggling that, as we stop, of course, we stop generating tax revenues.
Yeah.
We don't have an idea of how big the hit is, but it's significant.
Yeah.
So, of course, the protections need to come in.
Yeah.
And so far, we've heard the voice of organized groups really making the case for big business, for registered businesses in terms of tax incentives and those kind of cuts. But we haven't heard the incentives or the cushions for the unregistered. 80%, Kenya has the largest informal trading population in the world. And this is linked to inequality. This is also linked to how difficult it is as an informal trader to get into the formal system because it's expensive.
Yeah.
Access to trading space is very punitive, and that's, lots of cartels around markets or stores. So we have this huge informal population from hawkers that, sometimes are rendered totally illegal. Sometimes hawkers are then allowed to trade. Mama Mboga, who shows up and trades 3 times a week. So we have this large population that really, and informal trade contributes about 23%. There was the National Economic Report produced by Kipra estimated in 2017 that, they contribute about 23% to our GDP.
Yeah.
but they are then unseen because they are not registered. They don't have government protection. They don't have access to services in many cases. So there are a lot of tax, justice issues there because they do pay cess, for instance.
Yes.
But they used to pay cess. Cess is then on and off. I don't know whether it's been on right now. They have some licensing that they get into and get off to. There's been a lot of instability, but they do pay amounts to trade. Mm-hmm. They do pay like protection money.
Yes.
Mm-hmm. Yet they don't have access to basic services. Government is not supposed to be taxing people who don't have access to space, access to water, access to garbage collection. So this is a sector that already pays out of pocket a lot, earns subsistence level, and then pays out quite a lot just to earn that subsistence. So when you tell these people, okay, now go home, that's not an option. And the numbers are big. In Nairobi, we are not quite sure what the numbers are. Nairobi County was estimating, I think, something like 1.7 million in their first CIDP. Mm-hmm. But because they're unregistered, it's very hard to estimate. It could be as high as 2.3 million.
Yeah.
So there's this large group of Kenyans in urban areas that work at subsistence level that cannot afford to go home. So we need to, one, look at their costs and remove those costs. When you're talking about any licenses that are supposed to be levied, any kind of charges by the county, they pay for refuse management, they pay rents, remove all those costs, let water be accessible, so those basics have to happen. We haven't heard that. And then, of course, there are conversations about VAT, looking at essential goods and making sure all those are zero rated, so that in the first instance, people can survive. We are now dealing with survival. Yeah.
Does the government, this is the question here. We've been grappling with the idea back and forth. Things have been thrown there into what would be a circus here, into the ring, and said, does the government have the capacity to put these services in the hands of people then who can't afford to be away from work every day?
I think it's not just government. And part of the problem, and the other thing that has to happen is government has to adopt a human rights-based approach. Human rights-based approach, one, recognizes the inherent dignity of every person and the inherent right of each person to be involved in governance processes and their own governance processes. Mm-hmm. So, for instance, instead of clobbering people around a curfew, you do education. Mm-hmm. You then have dialogue with people. So what will it take for people to get home by a certain time? And you then design the measures in line with the reality on the ground. So first of all, government needs to listen, needs to dialogue, and then recognize. And I know Magafuli may be, I think, a little bit too blasé because, the idea of leaving everything running and everything open, including schools, I think is a bit too much. But he's right in saying the solution rests with us because we are the ones who have to change our behavior. We are the ones who have to monitor ourselves and look out for our neighbor. Government cannot do that for, the entire population of people. So the approach that I feel government needs to take, for instance, on health management, is there are community systems. There's a community-based health system that has been in place since, I was looking at literature this week, since around 2006. It's been part of government strategy. But it doesn't get the support it needs. It's given lip service. Donors are the ones who then come and put in money and train community health workers. Community health workers work up to the household. So, if you have, I was talking to one of the people responsible yesterday, and she was saying that they have access to 10,000 households because there are 5,000 health workers, and they are able to reach the 10,000 households in informal settlements directly. So you have an army of soldiers who do this work anyway. They support expectant mothers. They support They look out for, infant kind of care. So a mother's given birth, make sure she's going for the vaccinations. They look after patients who are on HIV treatment. They look out for the elderly. They visit them. They take them the medicine. They do the sensitization. This exists. And all these people are attached to the health facility, the dispensary, which is the level 1, the lowest level of health service delivery. Now, the problem, let me phrase my contributions proactively, because we're in a crisis, it's not time to blame. The opportunity and what needs to happen is the support needs to be given at level 1 and at community level. It was very disconcerting last week that clinicians at this level 1 in Nairobi supported. So the problem with the national response is likely to be centrism, because that's what happens when
and it's looking at a very big picture from another side.
Exactly.
As opposed to allowing also solutions to come from ground up.
Right.
It's interesting that you mentioned this. Yesterday, there's a clinic that had to be shut down in Ngara because somebody had tested positive, and this person had come into contact. Had come into contact with a nurse, and this nurse also was working with, of course, her colleagues there, and everybody in that facility has been put in quarantine. So a facility that was serving a population in Ngara has now been closed until fumigation happens, but the staff that were working there have been put in quarantine.
And taking into consideration that other people still come in to be treated for other ailments in that same facility.
They require the services. In fact, they were not coming to seek COVID-19 related services. They were coming for their normal services. Mothers coming for prenatal care and such.
Right. And the presumption is people will get infected, and the first port of call is the local dispensary. So they need to be prepared for that. So it's good that there was some immediate kind of action taken, but it shouldn't be offline for that long. So the main issue that the clinicians had raised is lack of what they are calling protective equipment. And this is, it's like the new gold, because you're looking at America, they're also talking about protective equipment because there's not enough of it. So number one, I think there's an absolute, we don't have an idea, because right now our messaging from government is not telling us how much protective equipment we need, but we can get a sense it's not enough. But then also, where is it going? I've heard stories, seen online stories, that people who are able are self-isolating and getting health provision, driven to them or taken to them because they're able to pay for it. That shouldn't happen. All healthcare workers have to be in the public system. I think there should be mandatory, even private need to,
go quasi-public.
That nationalized all healthcare services. That has to happen. What we're seeing with this pandemic is we haven't yet seen the worst of it. The numbers are going to burgeon. And the main thing is, where are the healthcare workers? Are they protected? And are they working at, the lower level? Is there good communication around that?
At the same time, Wanjiru, this whole conversation is exposing what the counties should have done and they're not doing. Because some of these things, like looking at level 1 facilities and all, that is the preserve of the county governments, and they've already been sensitized. Come on, put together your facilities, ensure that your workers are trained and they're given everything that they require. So as long as, yes, we have this national response committee, which also has a governor who is the chair of the health committee in the Council of Governors, it means that, for example, in Nairobi, in all the counties across the country, the governors are not thinking about the primary health care.
I'm a big defender of devolution, Eric. And of course, Nairobi is really painful because of this transfer of functions. But you're absolutely right. Most of the governors have betrayed the objects of devolution, which was to decentralize, and they have been funding healthcare at county level. So, for instance, in Nairobi, a lot of funding has been going to Mama Lucy and other higher county level facilities which are essentially referral. And the investment at the primary level has not been taking place, including even stocking of drugs has been very ad hoc and not up to scratch. So yes, we have a big challenge. And I think what COVID is going to teach us, and the lesson we need to quickly pick, is that we need to redress that wrong. The money needs to go down. And I'll just say that part of the problem we have with the way we've been doing development, national to county, is this idea that we need large, visible infrastructure projects that are politically very attractive and will win me votes. So money has been going into the wrong places. Actually, if you look at, government had a 2017 public expenditure review report, and they were saying the problem with the healthcare sector is one, the money being put in is not enough. Kenya is at 7% of the budget, 2% of GDP. They need to be at double that. Then the priorities are wrong. So one, the money is not enough. Then when it comes in, it's put in the wrong place. It's put into larger infrastructure as opposed to doing the level 1, level 2 support. And then it's inefficient. And then there's corruption. So these are the things that, this is the soft underbelly of Kenya's response. That we are expecting a lot from a sector that's been underfunded. So what can we do? We need to push government to make sure the first line of support is there, so that we don't have a centralized response, because that's not going to, you need a level of very strong central kind of management, but you also need this local level response. But then also we are ourselves. It's not time to point fingers and all matters. We're very unhappy with government. Government has really let us down in very many regards, national and county. Also ask, what can we do? So it's time for solidarity.
Why do you say it isn't time for pointing fingers? When is it a better time to point fingers?
City, yes, we can point fingers, but the crisis is such that we need to act. And I think it's something you were saying yesterday, that government has failed, so we need to ask ourselves, what can we do? So it's more of, let's not waste time pointing fingers. Maybe 5% is to say, okay, this hasn't happened.
But where we are where we are, we need to do something to ensure that we deal with this.